what's a good thing to do for nausea? So nausea can be a problem. Why do cancer patients get nausea? Google that one. You're going to come up with a lot of answers for that. But the biggest reason why cancer patients get nausea is if they have any intestinal cancer. So any intestinal cancer can cause a backup of bolus of food that could cause nausea. Different brain cancers can cause nausea because the nausea center is in the midbrain. That's in the deep part of the brain underneath the cerebrum of the brain. And a person can have nausea due to just food consumption. Food makes them feel sick. So there's multiple reasons why a person can have nausea with cancer. What do you do with it? Because nausea can cause all sorts of upset. You just don't feel good. You feel like you got the flu all the time. You feel like you don't, eating doesn't make it better. Sometimes does it make it worse. Sometimes I don't know what to eat. It gets very frustrating. It can bring a person down. So I know a lot about nausea because this is one of my major symptoms right here is nausea. So I get nausea all the time and I feel like I have the flu pretty much all the time. So what has helped me? We have two products that I think are really good. Personally, I have not used this, so I personally can't vouch for this, though I have some from patients that have used this and said that they thought it worked great. This product from Herb Farm. I use this Digize all the time. I have also used just straight peppermint when I didn't have Digize around. Digize has peppermint in it, has a little ginger in it, I believe. I've also used cinnamon bark. So cinnamon bark essential oil, I didn't put a picture of that on here, works a little bit differently. It's strong and astringent in your mouth, so it's a sharp oil, so it's a pretty hot oil. It's cinnamaldehyde is an aldehyde, so that is the chemical component of cinnamon. So the essential oil cinnamon bark has I think 90% of cinnamaldehyde, which is aldehydes are certain class of organic chemical. I use cinnamon bark as part of my protocol. I usually take a drop or two. That's all I take, 2 or 3 drops a day, because I think aldehydes can be beneficial to help kill cancer. But cinnamon also can help me with some nausea. At home in the car, I usually carry a bottle of Digize with me. If I get nausea, I take a drop. Just for me, nausea comes from the gut, but remember, it's a neurological function. So it stimulated the nausea center in the brain. So for me, if I stay busy, so that's why I work 10 hours a day, 12 hours a day. If I stay busy and keep my mind busy, I don't think about it. So my mind isn't on it and I don't think about it. It's usually when I relax and it's time just to kind of chill out and relax. I had a busy day, I'm gonna sit down, then I start feeling it worse. So I have a bottle of this sitting next to my chair at home that I usually sit in when I get home. So this has really helped me. You can't really take too much of this. I put the drops on your finger though, because it can be kind of a hot oil, and then put it in your mouth, on your tongue. This you can spray right in your mouth. So I would not drop this necessarily in your mouth until you get used to how much is coming out of the dropper. I'd start with putting it on your finger. But that's helped me a lot. That's helped me with nausea. Also with nausea, another help is make sure you're not constipated. So if you're constipated, you're going to have nausea. So you have to make sure you're not constipated, that you're having regular bowel movements. If you're not, make sure you're doing coffee enemas. Go to your constipation know-how sheet in your binder and make sure you deal with that appropriately as well.